Over the last 24 hours, we have identified 3,218 new cases of COVID-19 and completed about 9,350 tests. Our positivity rate for lab-confirmed tests is about 34.7%. As you know, due to the rapid rise of the Omicron variant, we adjusted PCR testing eligibility a few weeks ago to ensure those who have clinical risk factors, for severe outcomes, and those who live or work in high-risk settings can get tested and receive their results in a timely manner. We continue to monitor this approach closely and evaluate the capacity of our labs. At this point, we are able to meet the demand for all these high-risk individuals in a timely way, and we have the opportunity today to introduce a small change to PCR testing eligibility. Effective immediately, children under the age of 2 are again able to get tested for COVID-19 through AHS assessment centres. This is a pragmatic approach since rapid tests are currently not licensed for use in children under the age of 2. The ability to be tested affects the length of their required isolation due to COVID, as these children are also not eligible for vaccination. If a child is symptomatic and tests positive for COVID-19, they are required to isolate for 10 days. If they are symptomatic but test negative, they can leave isolation once their symptoms resolve. Given this requirement and the link to test results, we want to ease the burden on parents by allowing them to access PCR testing again, since rapid testing at home is not recommended for this age group. Parents and guardians can book appointments online for children under 2 years with symptoms using the AHS assessment tool or by calling 811. For older children who have symptoms, rapid tests can be used, which is why the change today is only for those under age 2. The current eligibility criteria include all those who are either immunized or unimmunized, who have a significant immune compromising condition, such as somebody who's under treatment for cancer, someone who's taking medication for an autoimmune condition that's suppressing their immune system. It also includes those who don't have the protection of vaccines, who have other conditions such as diabetes, for example. What the protocol is that as individuals become identified as having COVID-19, they're referred through the system to determine if they meet the eligibility criteria. They then have a conversation with a clinician who can determine, based on that particular individual's needs and clinical conditions and their context, which of the 2 treatment options. So we do have Paxlovid, we also have sotrovimab, the monoclonal antibody treatment that we've had available for several months, and which of those 2 treatments would be recommended for that individual. There's, at this time, of course, a limited supply, but as people become eligible, they will be offered that treatment. And if they fall into any of those eligibility criteria, that treatment will be offered as long as it is available, and hopefully we will be able to access more supply in the coming weeks and months. What we do know, again, is that we have both sotrovimab and Paxlovid. And so far, in terms of the demand for sotrovimab, we have had sufficient to meet the demand for people who qualify. So it would be my hope that that same would be true now that we have this additional medication to add to that suite of options for early treatment. But I would, of course, always encourage those who have not yet received the benefit that vaccines provide to take advantage of that, because that is the best and safest way of protecting yourself from severe outcomes of COVID.
Well, I'm one of the people that wants to see an end to the restriction exemption program, and as quickly as possible. But that's not right now, Rick. We are continuing to see upward movement in our inpatient bed hospitalization pressure from COVID-19. And we're at, in fact, the highest point in the 2 years in terms of people in hospital with COVID. So while there is some good news that can be encouraging for all of us, now is not the right time to be relaxing measures when the hospitals are under so much pressure. But I very much hope that we can move towards widespread relaxation of public health measures, including the proof of vaccination program in the foreseeable future, once we start to see the pressure on hospitals trend down. And we are going to make that decision based on data, based on what we're seeing in other jurisdictions that hit Omicron before Alberta. And of course, we'll take very seriously all of the public health advice that we receive. Rick, I would say I understand people's impatience. I share it. I did say when we brought in the proof of vaccination program back in early September that I did not foresee it going past the first quarter of 2022. That would be the end of March. And I am hopeful, based on the trends we're beginning to see here and we've seen elsewhere, that we'll be able to consider lifting that and most other public health measures well before that. So I'm not going to start guessing about when, which it's too early to do so. I would just say to people who are impatient, I am too, I get it, but let's just, after a couple of years of this thing, just keep our eye on the ball, have the backs of the people in our hospitals. Let's not start removing measures that could trip us back into higher transmission and hospitalizations when the hospitals are already under so much pressure. So that day you're talking about is coming. I'm pretty confident it will come in before the end of March. And I hope it comes, and I'll just tell you this, we will eliminate the restriction exemption program as soon as it is safe to do so.